All right, today's hot topic is arthritis. Now, arthritis, we understand, is a breakdown of the cartilage between the joints. It causes a lot of pain, inflammation, and it basically limits you from the activities that you typically love to do. So, what we're going to talk about is how we address arthritis here at Parr PT. It's a little bit different. So, in most cases, most PT clinics will, everything is focused on the pain, which it should be. You should have reduced inflammation. It might be, if we're using the knee as an example, it's really isolated to the knee. But what we found is most of the times, a knee issue is not really coming from the knee. Yes, some of the arthritis is there, but what's causing your body to compensate more to put additional strain? Because compensation is going to put additional strain on other joints in the body. Now, what we like to do is first is, from that reconnection standpoint, we're trying to get more muscle groups integrated, even if they're smaller. And so we find that even these smaller ones have a bigger impact on arthritis. Let's, again, use an example for the knee. So what we use here is myokinesthetics, which is a nerve and postural rebalancing technique that allows the brain to connect to the muscles a lot faster. That way you can utilize that muscle correctly without overcompensating, which would essentially cause stress on that joint. In addition to that, we have, myofascial release. That's the hands-on component, but what we really pride ourselves on is what we apply for movement. We can do stuff all day for pain, but if we're not addressing that stability around the knee or around the joint, it's going to be problematic for those with arthritis. So what we like to do is, full-on assessment, check movement, really check the small muscles that we know will compensate, some of these small muscles that will be a lot tighter, that will cause restrictions, and put the joint in different, an altered position that will cause more strain. So with that, we also want to make sure that when we're applying the movement, it's very subtle and very focused. So just because I have knee arthritis doesn't mean that I need to do everything at the knee. There might be an issue in the opposite shoulder that could be causing my body to rotate in a way that causes my knee to rotate in a different direction, therefore causing strain. So our idea behind treating arthritis is, yes, we're reducing the pain, but we're also trying to build stability around the area itself. So one, you don't have all the strain, but two, you're not constantly moving in a way that's going to be detrimental to that joint. So as we put the movements together, it's low-grade fundamental. We really focus on the first 2 weeks of trying to get your brain connected to the area, because a lot of times we don't even have the awareness. We don't know how we're moving. We don't know that we're twisting our knee one direction but throwing our shoulders in another direction. So as we start connecting the entire body specific to the area that's problematic from our arthritis standpoint, and depending on where it's at in the body, that's how we reconnect everything. And so now we've reconnected the brain. We've provided more fundamental movements that allow you to reduce compensation, therefore reducing strain. And now we've gotten stability in the right areas that allow you to have more stability, reducing strain, therefore reducing pain. Now, because the severity of arthritis can be different in others, obviously pain will be different in each person depending on, like I said, the severity and really what's needed. So treatments will vary, but ultimately when you apply the movement with specific treatments, everything goes together and really has a huge impact on reducing the pain symptoms of arthritis.